Hi everyone, thank you for joining us and welcome to today's webinar. So for those of you who are here for the first time, welcome. We are Sona. We are the third generation workforce management software built specifically for social care. Our mission is to build technology that makes a genuine difference to the lives of care managers and staff. We work with providers like iVolve, Coverage Care Services, United Response, Kishmill, Active Prospects, Community Integrated Care, Liaise, Greensleeves, and many, many more. So the chat function is available to everyone. Please make use of it today. We aim to share insights, comments, questions to our panel. The Sona team will also be present in the chat to answer any questions you might have. So we really encourage everyone to post your comments and questions as well. The webinar will be recorded and we'll send the recording in an email shortly afterwards. And finally, I have to add that all views expressed in today's webinar reflect only the speaker's views and not the wider views of their employer or organisation. So without further ado, I will let Hemel, our host today, take over and introduce our panel.
Amazing. Thank you very much, Abby. And yeah, pleased to be here today. And thanks to everyone for joining today's webinar. So just to give you a quick introduction to myself before I hand over to Debbie and Ruth to make introductions. My name is Hemel. I am the head of sales at Sona. I have been with Sona since pretty much day one, which is about 4 years ago. I actually knew the founders of Sona from a previous venture. And it's been my first time working in social care. I suppose that's been the big highlight. And it's actually been an incredibly, sometimes challenging, but very rewarding experience for me as well. And it's really been nice to see how the kind of care for residents and supported people translates across all levels and kind of hierarchies within care organizations as well. So it's been a really exciting journey for me, and also very keen today to kind of hear more context from Ruth and Debbie as well around their experiences of procuring tech in the social care space as well. And yes, please do feel free to throw lots of questions at us today as well. We're kind of very happy to answer them and very lucky to have the expertise that we do on the panel today. I'm told to remind everyone there is a free copy and biscotti for everyone who's joining, so please feel free to make use of that. That might be the only reason you're here. That's absolutely fine as well, but just to remind anyone who doesn't know that yeah, that's something that you can claim. Encouraging questions as well, as I mentioned, so please do feel free to contribute, and we'll do our best to make sure that we cover as many of those questions and answer them as we can. Yeah, and on that note, I will hand over, I think, firstly to Debbie, so she can introduce herself.
Hello, I'm Debbie Price, and I'm the Chief Executive of Coverage Care Services.
Over to you, Ruth.
Hi, and I'm Ruth Hallett. I work for a company called R2H Consulting, and I'm currently interim head of change at United Response, but I'm also leading the Nourish rollout in Brandon Trust at the moment.
Amazing, brilliant. Right, so before we get to the really challenging questions, I don't think they're that challenging. Let's start with a simple one to kind of get into our webinar today. So I suppose question for both of you, Debbie and Ruth. Maybe Debbie, you can start. I'd be curious just to hear how you first got started working in social care and what your experience has been like, I suppose, in that time.
Okay. I started in social care 40 years ago this year, actually.
Congratulations.
I wanted to be a social worker and was advised to go and work in a care home for a few years and get some experience, because you had to be 21 in those days before you could get your social work qualification. So I started as a carer and I never looked back really, and didn't ever get to be a social worker. So I worked with elderly in London for 3 or 4 years. And then I moved to Shropshire and I spent 18 years running services for adults with learning disabilities. At which point I took a complete career change and went to work for an umbrella organisation representing all of the care providers in Shropshire, Telford and Wrekin, and became, I had 10 years there and left as the chief executive of that organisation, and learnt a lot, working with all types of providers, liaising with local authorities, PCTs and its iterations, and was offered the opportunity to be the operations director at Coverage Care 9 years ago. And 3 years ago, I became the Chief Executive of Coverage Care. So that's a very quick whistle-stop tour of my career.
Amazing. Yeah, that's a very relevant journey as well today. I'm sure there'll be lots of questions on that. And yeah, over to you, Ruth. Tell us more about your start in social care.
Yeah, mine was a very different journey. My mum was a bit of a hippie. So I was like, what's the biggest form of rebellion I can do? I was like, join a corporate. So I went and started my career at KPMG, which was great because they invested loads of money in training, but fundamentally didn't align with my values. I went to work for a small tech company, and we had to work for on a project for British American Tobacco, which, we won an award from Microsoft. But actually, I was sitting in the pub with my friend, and he's like, my dad's not banking. So I was like, this is rubbish, isn't it? So I quit my job and I went self-employed, and I've been self-employed for the last 21 years, only working for organisations which deliver some kind of social value. So I've worked for prison service and probation, as well as police, NHS, local authorities, and more recently social care. All of it hopefully making difference to people's lives and slightly repenting for my sins in my earlier career.
We forgive you, Ruth. Don't worry. Amazing. Brilliant. Let's maybe get a bit of context as well. So Debbie, if you could hear a bit more about Coverage Care in terms of number of employees, the type of care you specialize in. I know we know each other pretty well by now as well. It'd be great to kind of hear some of the challenges you've had, and both in terms of tech and transformation and generally as well in your time with Coverage.
Okay, so Coverage Care primarily provides services to older people, although we are now starting to see more younger people come through our services. We have 11 care homes, residential and nursing, and 1 learning disability respite service. We only operate in Shropshire, Telford and Wrekin. We have 1,100 staff, and we provide services to 686 people. We're the largest provider in Shropshire, Telford and Wrekin, and we are celebrating our 30th anniversary this year. It started 30 years ago by taking over the local authority services, and over the years we have closed some of those services because we've got new builds that we've built and we've moved people into better accommodation, really. But we continue to operate. We did have a domiciliary service that we closed a few years ago, and we've recognised that actually what we want to do is be experts in residential and nursing services, particularly providing services for people with dementia.
Amazing, brilliant. And is there any in particular kind of driver around digitization for you? Was there anything that kind of made you think, okay, this is the time really to review how we do things and how tech may kind of play a role in supporting that?
2 probably. I think as the organisation's grown, and particularly our staff group has grown, we, up until the last couple of years, have been working on through paper systems and through spreadsheets. Trying to do payroll on a spreadsheet is an absolute nightmare. I'm very grateful it wasn't me that had to do it, but for the staff that did, it kept crashing. It didn't link in with Sage very easily. It just became a nightmare for the staff to use. And we also have some quite complicated rotas, and being able to track those and be able to manage them was becoming more and more difficult. So that's why we started to think about moving to a digital solution for our real-time rota, payroll, time and attendance modules, because it made sense if we were going to do something that we do it in its entirety and we get it right and we get a system that's seamless. We have other digitals, so we have digital care plans, and that really was driven by the opportunity for the initial funding grants that the government were giving 12 to 18 months ago. We'd looked at them about 5 or 6 years ago, and at that time, I have to say, I wasn't particularly impressed with what was out there. It felt at that time that it fulfilled some of what we needed, but not all of it. So if we were going to move to it during that time, we would have had to have some on paper and some on digital. And I was really worried about not having everything in one place. And then COVID hit, and we just, you don't think about anything other than surviving those 2 or 3 years, really. But the government then reintroduced the grant funding, and I seriously started to look at digital care plans, and was amazed at how far they'd come, really. So that was what encouraged me to go forward and to be able to implement our digital care plans. And once we'd started those, we've now got PainCheck that uses AI functionality. We're looking at other digital solutions for our business, so electronic authorization for our finances, being able to manage our POs centrally. It's really just escalated. It's been a domino effect. We've introduced one, seen the benefit of doing it, and encouraged us to look at the rest of the business to see how it can support us to streamline and provide a better service.
Amazing. Yeah, that's really interesting, because I've heard from a number of providers that actually, even though the government grants weren't always the most easily accessible, it did kind of kick off a lot of thinking around digitization and how that could work for organizations as well. So it's been positive in that sense, I think, from what I've seen. Yeah, I'm sure we'll come back to some of those points as well, Debbie. I suppose from your perspective, Ruth, it'd be great to hear if there are people, I suppose, within social care who are slightly nervous about digitization and technology. What kind of advice would you share based on your experience?
So people quite often say people are resistant to change. I fundamentally sort of disagree with that opinion. I think people are resistant to things they're not in control of. So actually, if you go and talk to people and listen, find out what's driving their concern, normally you can unpick it and go, okay, right, let's work with that. And actually, if you can get those people who have got concerns, and they're not completely legitimate, normally you can kind of work with those people and actually bring them into your project team, help them shape what you're doing, help them influence what you're doing. I know that we had an individual who now laughs because he's leading, project managing alongside me, the Nourish work in Brandon, who was utterly resistant to implementing a roster system. And he was brought in and said, well, if you really feel this strongly, you run the project, you make it work. And he's completely changed his opinion and is now leading a lot of the business systems work. So I genuinely believe, go out, listen, talk to people, find out what their concerns are, and actually they won't be resistant. They will come on that journey with you and actually help make a better outcome and make sure that people do adopt it.
That's super interesting. Yeah. What kind of concerns do you hear out of interest? Are there any examples that come up quite often?
I think it's just lack of understanding often. People don't know what it means. And if you don't understand what it looks like or feels like, often going and getting people to go to another organisation who's already using it, getting someone to come and chat about, okay, it hasn't been so difficult for us and these were the advantages. I know I had some nurses who were very nervous about working in a social care provider, nervous about using a digital system. Actually just getting some nurses from another organisation to come and have a chat with them, eliminated some of their concerns. So it's about finding peers and others to kind of help. It's, as a project team, they're going to always think you're trying to sell it. Well, actually, we're not. We're trying to sell it. We're trying to actually help people do their jobs in an easier way. So let the people have the conversations. And, there will be things that are never 100% right. But if 95% of it is better and 5% is a little bit more of a pain, then so be it. And actually, let's focus on those things and then try and improve the product and work with the software provider to kind of fix those last little bits and pieces.
Yeah, amazing. Yeah. Has that been your experience as well, Debbie? I know that one thing we often hear is nervousness about whether frontline teams are ready actually for digitization or just concerns that people are used to doing things the way they've always done things as well. And there'll be resistance to using things like apps and technology as well. Is that your experience as well?
Absolutely. The first time we introduced any sort of digital solution, then absolutely. What I found is once we've done it once, they'll accept anything that we now start to bring in because they don't have that fear. Again, we did the same. I had people in our homes that were absolutely, no way am I going to touch this, and we made them champions. We worked with them, spent a lot of time getting them used to using it, and they then became the champions in the home. They were going around saying, if I can do it, anyone can do it. And they'd sit with people and they'd spend time. And I think don't underestimate how much hand-holding that, and if you're just first transitioning, how much hand-holding people need initially to become comfortable with it. But once they are, that you don't look back. You really don't. And I'm fortunate to have been able to select a team of 4 people that became the experts in whatever digital solution we were introducing, and I moved them from home to home so that they became the people that had a consistent approach to how we did it, supporting both the manager and the staff to make sure that they were able to implement it, but also be the troubleshooters. If there were problems, they could problem solve on the spot and really, not let anything build into a massive problem. And that approach has worked, and we've kept that approach with everything that we've introduced or will be introducing over the next 12 to 18 months.
Yeah, really interesting. And I suppose it's quite an interesting dynamic that you sometimes hear. Well, I often hear from organizations in social care that there is concern that people aren't ready for transformation, and then in the same conversation I'll hear, we don't want people using their mobile phones whilst they're working shifts as well. So it's like, okay, so they do have phones and they are kind of comfortable using modern apps.
Exactly.
What about kind of things that can make it easier to book holiday or kind of pick up overtime and those bits and pieces as well? Amazing. So just to kind of move on to talking about the process of procuring technology, I suppose, generally. Ruth, from your experience in terms of running procurement processes, again, you can kind of leave this fairly open as well. Are there any kind of best practice tips that you would share, or any kind of advice you would share about how that can work?
I think it's important to have a process defined before you start, and to really start with listening, as I said before, to the users. I always go out and go and do some observations about what people are doing, go and understand, make sure you've got operational people part of your team, and really listening to what people say. And then effectively, once you understand what you need the product to do, then going out and testing that in the market and getting kind of feedback. But you also need to make sure you've got the right skill mix on your team, because you do need the finance people involved to check the numbers are right. You do need the tech team to make sure things are interoperable. You have got the right APIs, and you have got the right kind of things which will allow it to connect to other products.
Yeah.
But if you aren't asking those questions up front, you don't really know how those things will interact with your rest of your products in your organization. So it's important to get that right from the start. And I'll also make sure you're kind of doing the due diligence on the company. How big are they? How long have they been running? Those types of questions. And I've kind of got a standard kind of format that I often use with organizations, which I'll always leave with them and say, keep on using it as a framework for taking things forward. And then in terms of demos, I'm not a big fan of sales pitches. I always think it's important I normally give some real live scenarios and say, tell us how your product will address these scenarios based on some real situations, which are rather than just seeing how it works when you're running the happy path or the ideal way of it working. So you can kind of test and see how those nuances of your organization will get teased out. I'd also make sure that you then get access to a test site to have a play with, because it's all very well in an hour demo, but actually if you can start having a bit of a play with it beforehand, you can kind of get a feel for it. And the other thing I always do is try and get a couple of reference sites where I ask the supplier not to come, but to give us some people they've worked with. And then you can ask those real questions without the supplier in the room and say, how did you find this? Whatever. And actually those people have often been good people to carry on having a relationship with afterwards, when you're actually starting to configure it and go, how do you do this? How did you fix this issue? And some of it is got nothing to do with the tech. Some of it is business process and policy changes, which requires, the organisations. We're all often trying to solve very similar problems, and there's no harm in sharing some of that learning together and working across the sector. And we don't all have to make the same mistakes.
Amazing. Yeah, it always breaks my heart a little bit when people say they don't like sales demos, but I do understand it as well. And I'd agree. Actually, sometimes it can be quite powerful to use actual examples of challenges you're having and say, actually, rather than looking at, I want feature X, this is the problem I have, and like, how could you help me with this problem as well? So I think that's a really interesting insight. I suppose similar question for you, Debbie. You mentioned this team before, that you have these kind of experts that you can rely on to kind of pick up digital transformation projects and kind of move from location to location. How did you go about kind of honing in on that team, and have you used things like buying committees previously, and how do you kind of look at I suppose kind of shortlisting, etc., and finding the right suppliers for the right challenges that you have?
Okay. I think I'm going to echo a lot of what's just been said, really, insofar as we sit down and really process map what it is that we want, that we're doing now, and that we want it to do when it transitions to a digital solution. So that when we're talking to companies, we can be really clear about what it is that we need them to show us how it's going to work. You know, how are you going to make this work? Having a checklist, I find, so I write a checklist down of all the different questions that I want to ask, so that I'm consistent with different providers in what it is that I'm asking them, because then I can go back and reflect on what they've said and kind of, in a lot of ways, hone down, for me, where you might have 5, for the care planning, I had 9 companies that I had to look at, and it was getting it down to 2 or 3 that I could then show to my managers and to selected people within my team. So we made the final choice together, but I'd kind of brought it down to a manageable amount, and using that checklist was really helpful, and we'll continue to do that. And then depending on what it is that we're wanting to work that we're wanting to digitalize will depend on who's involved in that team. So primarily for Sona, for the products that we've got through you, it's our HR department working with our managers, and the finance director is also involved. For the finance solutions that we're implementing from April, it's primarily the finance team with some support from HR and from operations. So it's really just looking at the system and deciding who are the right people to be testing it, to be helping to build the system that you're having, and then those same people will be the people that I use to implement it in the homes, because in being involved from day one, they become the internal experts, really, and they're the ones that can go out and do the hand holding and the making it work, and selling it to the homes and to the teams. Very much so, yeah.
Amazing. I would just kind of just to raise one point as well. If there are any questions from everyone joining today, please feel free to raise them in the thread here, and we can share them with Debbie and Ruth as well. So please don't be shy. Right, I'll kind of talk about maybe a bit more of a kind of current topic as well. So obviously one of the things we're hearing about a lot from partners in social care is the impact of the budget, and obviously April's kind of pending as well. From both your perspectives, I suppose, Ruth, maybe for you to start with, what are you hearing from kind of the care organisations that you've worked with around the budget, and is that driving more of a focus on digitalisation? Is that making people more nervous? And do you have any advice around that as well? Or
I mean, I think I'm going to echo what Debbie was saying earlier, in so much as obviously the context is really difficult, but the conversations that are happening in the organisations I'm working with are very much, well, we need to digitise, and actually, if we're going to spend money anywhere, it's going to be on that digitisation, which feels challenging and tricky. But without it, we've got so much inefficiency of double entry of data, and managers spending time doing things which add no value to the people we support, that actually we need to be freeing their time up, their valuable time, to be doing the things which make a difference to people's lives. So actually, the digital investment isn't going to stop as a result of the financial challenges. And people are continuing to invest in both the organisations I'm working in currently, where they see it as a real priority to make people's lives easier.
I think it's also the governance and the oversight that these systems give you, whether you're a single operator or you've got multiple sites, being able to have oversight of your payroll system or your digital care plans really is essential. And for the managers, the feedback I've had is that actually, because managers are inherently, they work 24/7 really, and that they're on call, they deal with any problems within their particular service, is that they can get onto the digital platforms, have a look at things, make informed decisions without having to jump in the car and drive miles to the service, have a look at the file that they would have looked at, and then make those decisions. So it's made their life much easier. from our central office, I can see everybody's care plan. I will, once we fully implemented the Sona system, we'll be able to get onto the payroll, get reports, get real live data. That is going to help me to run a safer and more effective service. And I know that that's what's going to happen, because it's definitely what's happening with my operations hat on with the care plans. So I'm looking forward to being able to do that with the chief exec's hat on. When I want to go in and pull off reports around, what's happening in my service with payroll, time and attendance, all those sorts of things that I need to know when I report onto my board.
Yeah, that's super interesting as well. And I suppose data is probably an interesting topic to talk about as well, in terms of management reporting and the kind of things you need to act. Is that one of the factors that you both find is really kind of drives the need for digitization, i.e. just the access to knowing what's happening on the front lines? Are there any priorities around that you look at as well, that you need to be able to access at the click of a button? That would be interesting to hear.
I would. My concern around data is there's often because organizations are small, so there's often a data person. So one of the things I've been looking to do is connect up, because I work across lots of different organizations, connect up those data people to kind of have a conversation together about how they can help each other. Because some of those data people are much more technical. Some of them have come more from an ops background, so really understand what the data needs to be used for. And actually, it's quite isolating being in an organisation on your own, trying to kind of figure all of this out yourself. And there isn't, I suppose, a network. And I'm hoping, obviously, with some of the national stuff that's coming out, we'll get a bit more kind of support. But yesterday, for example, I had 5 organisations come together just to have an initial conversation about what are we all doing in this space, and what are we trying to solve, and what dashboards are you looking at, what types of things, and just thinking about how we share information across our sector, because we're not going to be able to, advocate for the whole of the social care sector very easily if we haven't got the data to evidence the support that we're providing and the added value that we're giving. I always think, because I work quite often with NHS organisations, I feel often the NHS doesn't really always totally understand or value all the people who know those people best often work in social care, and actually they'll be able to tell if someone's going off. But actually, if you can't give the data, in NHS speak, you often can't advocate as well as you could on behalf of somebody. So I think data is going to be really powerful in advocating both for the whole social care sector and financial arrangements, but also for those individual people we support, and being able to have those conversations. And I think we really need to think about how we join up and link up across NHS and social care, because we're talking about people who aren't just in social care or in the NHS. They're actually, working with both sets of organisations, and often they're the only people who really know what's going on. If you've got somebody who's not able to advocate on their own behalf, maybe a dementia or a learning disability, then actually that data can be really powerful, and that sharing can be really powerful.
Amazing. Totally agree. Sorry, Debbie, did you have anything to add to that as well?
I think the NHS has got a long way to go before it's going to be sharing any data or accepting our data, actually. But you're right. I mean, it's where we need to, absolutely where we need to go. And already I can see with care plans, so providers are asked at the drop of a hat for a continuing healthcare assessment to share somebody's full care plan, and that's either scanning it and sending it across, or it's photocopying it and taking it across to their teams. With the digital solution, you can give them limited access to the exact information that you want them to see, not everything, for a set period of time. They can go in, have a look at it. You don't have to do any more than that. It saves so much time and effort, and actually printing costs and sort of admin time in scanning things. The benefit is huge, and I hadn't anticipated that when we did it. I had anticipated other benefits, but actually the more you use it, the more you find that you're benefiting from having it.
Absolutely, yeah. I've got a question there as well, actually, about retention. I'll just share one of the questions we have on the thread here from Russ at Aria here, who I know well. How are you, Russ? And it's for Debbie. This is a very Sona-centric question. But Debbie, what stage are you at with your Sona implementation? And can you confirm what modules you're implementing as well?
Yeah, sure. So payroll. So we're implementing time and attendance, real-time rota, and HR. And it links to our the payroll. The information will link to our Sage program that we use, and that was one of the questions initially when we were talking with Sona was about being able to link into other systems that we're using, because I've found over time that, and you probably won't like this, but there is no one system for everything. Some systems work better than others, and being able to link them was the solution for us, because actually, I don't mind saying that a few years ago, a predecessor of mine signed us up to a system that was supposed to do everything, bells and whistles, cost an absolute fortune. We didn't at any point ever end up engaging with it because it couldn't do anything that we wanted it to do. And ended up in a big, in quite a long, drawn-out battle to get out of that contract. So we were quite hesitant about going into a new contract and looking at providers. And we put Hemel through his paces, I have to say. Because we did what you said, Ruth. We had our checklist and we wanted to use it, and we really wanted to test it before we signed up to it. And to be fair, Sona were open to that. And that's one of the reasons that we went with them, because we found we'd got a partner that would work with us, but equally would be open to supporting the software to meet our business needs as we change going forward. So the kind of the research and development and the building on what they've already got is an important part for me in a digital partner, because nothing stands still. Our organisation will continue to evolve, and we need that digital solution to evolve with us. And we have spoken at length about this, Hemel, and it was one of the contributing factors to me choosing Sona, without a doubt. In terms of implementation, we have spent a long time developing the service that we want, and we have trialled it in one of our smaller homes, and a smaller home is 40-bedded residential home and in a 90-bedded nursing home. And we are just ready now to roll it out to the rest of the organisation.
Amazing.
We're in the process of building the HR. We found once we'd started on the payroll and the time and attendance that actually, to fully utilise it, we needed the HR module as well. So we've just signed up to that, and my HR team are working with Sona to develop that module with a view that we'll be rolling that out with the payroll April onwards.
Amazing. Brilliant. Very exciting. It was a very enjoyable process, I thought, as well. But anyway, just to move on to some questions from the thread. So a question from Miles. Interested to hear Ruth and Debbie's thoughts on what they think will be some of the significant hurdles to overcome in implementing data integration and shared records between NHS and social care. I know that you're very passionate about this, Ruth, so maybe I'll kind of forward that on to you first.
I think, I'd say social care isn't one thing. That obviously makes it harder, if that makes sense. Lots of independent organisations and people have obviously implemented different solutions, but I think it will be key about what the data standards are and being kind of building confidence around that sharing of information and what can and can't be shared. It feels a very similar conversation to what was happening in the NHS with GPs about sharing patient records. And now, people can access their own records on there. And I think the question is, whose information is it? I think kind of we probably need to tease that out a bit more, because the organisation needs it to run their organisation. But actually, if it's about somebody, do they have, the right to access their own information? So I think there's quite a lot to tease out there. But I think with the kind of introduction of kind of neighbourhood teams and the government push around looking at the people who use the most NHS service and thinking about how we are more proactive and preventative rather than reactive, and the whole, when you look at the stories when I worked in A&E and you look at the people who are bouncing in and out, it's no good for those people. It's no good for their family members. And it's costing a load of money. Like, nobody wins from that scenario. And they don't always get the interventional support that they need. So I think it's really important that we think more carefully about how we make that experience better for everybody involved. And I do think sharing of data will be absolutely key to that. So how do we notice those obs are becoming off? How do we then provide a different support in someone's own home, whether that's their residential setting or their own individual home? And how do we think more carefully about that?
Yeah, absolutely. Have you seen any progress towards that goal, Debbie, I suppose, from your perspective, or do you find it still very disconnected in terms of getting the data that could be useful from the NHS within a social care setting?
Part of our digital care plans, they've recently introduced GP Connect. So it means that we can get our residents' EMIS summaries, which is absolutely critical, particularly for new admissions, but especially for people that have gone into hospital and are returning to us, because we find that we don't get the discharge letters in the way that we used to, or they're going straight to GPs, but they don't necessarily tell us. So being able to go straight on to the EMIS summary and see what's happened and what medications has been absolutely, it's changed how we can meet people's needs, but also given us confidence to accept admissions out of hours, weekends, because we're not left in this void where you can't get any information and you can't support somebody if something goes wrong.
That's super interesting. Yeah. Let's take one more question as well. So we got another question from Russ as well for Debbie. So Debbie, is effective communication to your teams a challenge, particularly team members that don't have easy access to work technology?
Digital solutions have made a huge difference in us being able to connect with our staff. So we're able to, both with Sona and with our digital provider, leave messages for people at handover, so they have an electronic handover. All the information's gathered during the shift, and then it's summarised. They can't, when they get the handset, they can't actually, when they log on, get any further until they've read the handover, kind of click to say that they've read it, and then it takes you into, they can then start using it. And you can leave messages for staff on that platform. We do have staff that might not have digital solution, phones or iPads or laptops. What we've done is we've bought laptops and iPads that we keep in the home, and then we have staff that will support people to either log in, if they, sign in and sign out, or be able to use it for training. So we have a digital training platform. Everybody does some digital training as well as face-to-face. Again, they use this technology. They've got people there to support them. I haven't actually found that it's too much of a problem, to be perfectly honest. I anticipated it would, and it hasn't been, which is to my surprise and delight, really. But it has definitely improved the opportunity for us to be able to engage. And I have run a survey, a survey monkey actually, of my 1,100 staff, and I had 870 staff return, which I'm really pleased about. And of that, 95% of my staff are happy with the digital solutions and can see the benefits of having it. So I think we've taken a long time to introduce it. We've thought through what we want, how we wanted to do that, and we're actually, I'm seeing the benefit of it.
Amazing, brilliant. Right, I think we're getting almost to time, so we'll probably move on to one of our finishing questions. I don't want to kind of repeat old ground as well. So we were, I suppose, let's kind of keep this fairly open as well, I suppose, for you, Ruth, in terms of any other thoughts generally you'd like to share with people who are kind of looking at their purchasing journey, maybe particularly around how you prioritize and what it is you kind of look for when you decide, okay, is this a process thing, or is this a digitization thing, or is it a combination of both? Any context there would be really interesting to hear.
And to go back to the first part of your question, which is around, is there anything else? I think it's also really important that we have a role in as social care purchasers in influencing other organisations. So I always make sure as part of the procurement process, I've got questions around what's your carbon footprint and what are you doing to reduce your carbon footprint? How are you contributing as an organisation to social value? What are you doing for the well-being of your staff, in improving kind of gender equality on your boards, or thinking about how you kind of move those things, that wider, broader agenda? Are you giving volunteering days to your staff, those types of opportunities? And, you know, often I'll say, well, would you like to come and volunteer for the organisation I'm working in, or maybe as part of that partnership and that building, the relationship thing.
Yeah.
And also thinking about that kind of wider ESG. And it's quite interesting because there is quite, when we're scoring providers, and I've been working on a new expenses system as well, and a number of other procurements at the moment, there is quite a variation. And some people, you can very much see some of them are doing it as a tick box, so they've got something to put in the box, and others who genuinely believe that those things are important. And that really does shine through. And as organisations, the government policy is saying that we need to kind of, part of the scoring will be social value for us as an organisation, as a social care provider. Being able to demonstrate we're asking that throughout our supply chain, I think, will become increasingly important. So I think we need to kind of bear that in mind, and also in terms of kind of web accessibility and those are the types of things we really ought to be asking those questions as part of that procurement. So even if people aren't thinking about it now, we're prompting and triggering those questions. I wouldn't say it'd be a swing question as to whether we would go with the provider or not, but even by having those conversations, I think we're probably influencing what people are thinking about in terms of procurements kind of going forward, and what people, you know, put in their priority list.
Yep. Absolutely agree. Yeah. And how about yourself, Debbie? I think we only have a minute, but any closing thoughts or any other advice you'd share with anyone embarking on this journey for the first time?
I think to be really clear what you want. What I will share is, of the 2 homes that we have implemented Sona into, I have absolutely seen more staff picking up shifts and a reduction in our agency. And it's that kind of reduction in agency use, reduction in printing and paper, and better use of time that is going to enable us to pick up the license costs going forward for digitalising. So in a way, it will pay for itself. It's that first year that might hurt a little bit, because you're paying for something that you're not really realising at that point. But I can see the start of that realisation financially, and then you can, with a view that that's, you know, why I'm moving forward with other digital solutions, and it's enabling us to be able to pay for that.
Amazing. Brilliant. Very glad to hear it. Brilliant. If there are any other questions from the thread, feel free to share them or reach out to us. Otherwise, thank you so much, Debbie and Ruth. It's been really great to catch up with you both today, and for sharing your perspective. And I'll hand it back to Abby.
Thank you so much. Thanks very much to our panel, as Hemel said, Debbie and Ruth, for joining us. Thank you to our host, Hemel, and thank you everyone who participated today, coming with your questions and engaging with us in the chat. As we mentioned, you'll receive the recording later today in the email with your voucher for your coffee and biscotti, and we hope to see you all at one of our next webinars. So thank you, everyone, and have a lovely afternoon. Thanks, Mike.
Thank you all. Take care. Bye.
Bye.